I'm Eli Neal, and today my dad is going to be doing a cataract surgery. This is number 22, I think, maybe 23. I will check. Yeah, 1 sec, I'll tell you after. So first things first, he's going to be doing. This is 23. So this is a block saw. So I'm gonna just kind of. It's mostly the same. He's gonna be making 2 incisions. This is the larger incision. It's where he's putting the needle through. This is where he puts in antibiotics. This is where he puts in viscoelastic, which is what he's doing right now. And he does a capsulorhexis.
There's that. Oh, he's all done. Amanda's right. You're doing her now. And this one's next.
What about 23?
We're not there yet.
I thought I was on 23.
No.
Oh. Wait, what did I just do before this one?
Well, we should be on. He's done. Christopher. Yes, he did. Christopher.
And then the last one.
And then right now, they're doing Amanda Jones. And then we're doing this one, Esther. And then we'll do this one, this one, this one.
Huh. I already have 23. This is the 23rd video, though. So.
Well, you know what? Well, there were 2 people that had 2 different eyes, but they're still numbered. I don't know. All I know is they're doing Amanda right now, and then we're going to do Esther, and then this.
Okay, well then. Oh, I thought we did Amanda last time.
No. That was the one we.
Last one was.
No, we did. He's just done. So Christopher's done.
He's done.
And then Amanda's in there right now.
Yep.
All right. And now the next one going in is.
Okay, well, sorry about that confusion, but apparently this is number 22, not 23. So I already told you most of it, that he's going to be doing the capsulorhexis, which is where he uses tweezers to make a circle incision. Then he'll be putting in the lens, and he will be done. So I'll jump in if there's anything notable, and thank you.
Fortunately, the lens is not super dense, so that's a relief. But let me see how much movement there is in this lens, Ben. I mean, just like bouncing and jittering everywhere. All right. Huh. I'm afraid to rotate it. Can you guys see okay?
Okay, looks like he's doing. Looks like he's using the phaco handpiece right now. He's using this to sculpt the cataract into smaller pieces so that he can use the mini vacuum to vacuum them out. Okay.
Wow. I mean, it's you guys can't see that, but it's super deep in there. Yeah, if we didn't have the ring, this bag would be toast. Okay, let's get the IA. We're going to meticulously polish this lens. I mean, the capsule. What's the bottle height?
90.
Give me 60.
60?
Actually 50. Let's go real gentle. Easy. I don't wanna. Okay, go 40.
40?
Okay. Gentle, very gentle. irrigate over the wrinkles. The downside of doing the capsule, so if we hadn't done the capsule tension ring, this bag would already be toast. But the downside of it is it's in the capsule fornix, and it can trap some of the cortex. So it's kind of being a little bit difficult to pull on.
Does that stay in there?
Yeah, it does. And it's nice because it gives you something structural to throw a suture around. So, I mean, there's a part of you that's like, if you have a lady whose bag is so weak, and you put a $1,000 refractive lens in there, what confidence do you have that this lens is going to stay put? You know, like, what's going to happen 5 years, 10 years from now? And it may be that this bag is gonna shift left, right, sunset, something like that. But if we can preserve the capsule, then we have lots of options for stabilizing it. She's got plans, you know. She doesn't want to worry about any of this stuff.
That's right.
Well, so far, my dear, it looks like we're going to get away with it. Although, I got to tell you, this eye is weaker than the right one.
Really?
Yeah. Okay. Yeah, it definitely is. Sorry, I have the sniffles. You have to listen to me. Do we have an axis on this lens?
We are at 98.
Okay. What I'm doing here, Ben, is using the edge of this little instrument to just kind of scrape the epithelial cells off the anterior capsule. If you don't do that, they can contract really strongly. And I do this for all refractive lenses just because there's a pretty good chance that they're going to need a lens exchange. And if the capsule's really clean, then that is a lot easier and safer down the road. Plus, if you leave a bunch of cortex on one side, then that side's going to contract when the other one doesn't, and your nicely centered IOL is now, right, yeah, it's shifted or torqued or tilted. So it really does work better to have a pristine capsule. I'm definitely not as militant with like our silvers who are okay wearing glasses. If their IOL shifts or tilts, so they got a little astigmatism, you know, it's not a big deal. But this gal's not going to be pleased if, you know, even 5 years from now. Okay, so what I want to do with you is I want to have you look directly at that marshmallow light. Can you see it?
Mm-hmm.
That's good. So that the lens is pretty well centered. It could shift a little bit superiorly, like that. I think that'll be good. Gentle, gentle, gentle. Let's see the angle marker. We're at 98.
98.
Yeah. Which is like, it's right at this blood vessel right here. So I think it's just about right. BSS. You know what? How much Anacavisc do I have left? Yeah. Do we? Let me fill it up and I may enlarge the rexus a little bit. Probably, but what I really want right now is I want the 30 gauge needle for BSS, and then I want the Utratas. Thanks. Then what I want to do here is I want to make the rexus bigger. But to get it started, I have to make a little tag that I can grab with a forceps, right? Kind of like that. Okay, Utratas now. So ideally, we have like a 0.5 millimeter of overlap all the way around the optic. If we have too much overlap, oh, here we are with the whole thing moving again. If we have too much overlap, then you run a risk that it's going to contract or fibrose. Irrigate that, please. Anytime you see wrinkles, you can just keep it wet, and then the fluid fills in the wrinkles. Oh, all right, okay. So let's start another, we gotta start another tear. It's that one. I'm just concerned about this area here.
With this rexus, just tear them off. Natural lines in it.
Yeah, it kind of tears just like cellophane. Thanks. Wet. It's not easy to see. If I pull too hard, the whole thing's going to come unzipped and we're going to have a real problem. Let's do, let me see the needle to my left hand. Thanks. Maybe we can do a little bimanual technique here. Did I get it? No, I didn't really, did I? Thanks, Selma. Appreciate it. Keep dripping it on there. Aha! Like that. That's what I wanted. So you can see a little better over here. The cornea is a little more clear. Okay. You know, I think doing more than that would be really tempting fate. Okay. Do you guys all agree? Okay. That looks really nice. That looks really nice. There we go. I don't think we'll have to do IA. I think we just irrigate it out. I'll let a BSS. Do you have any more? You got enough air under there? Are you having as much fun as I am?
Yeah. No, I'm just here.
Okay, that's good. You know, you may have waited 3 hours, but I think I just lost 3 years of my life doing this surgery. Oh my gosh, it's gonna be good. It's gonna be worth it. Okay.
Okay.
Sure. Okay, look at the marshmallow. And let me nudge this guy over. Looking right at it? Okay, that's good. Moxidex, thank you. Well, so much for my plan of speeding through the rest of my cases. Gosh. All right. If this stings, okay, that's normal. Yeah, little sting there. Don't even sweat it.
Oh, sure.
Okay. Easy for me to say.
Yeah.